We are learning more tonight about bird flu and its potential impact here in Missouri.
5 on your side's Tracy Henson spoke with regional experts about what you need to know. Tracy.
Okay, so let's start at the beginning. There's only one confirmed human case of bird flu in Missouri. That case is one of 15 reported nationwide since 2022. However, this Missouri case is unusual because there is no animal link to that case.
They usually get it through contact with infected birds, or in this outbreak, also contact with infected dairy cattle, because the virus has spilled over from birds into dairy cattle.
But there's one case that doesn't fall in line with those parameters, at least not yet.
There's the one case in Missouri that did not have a known animal exposure.
That case is not in St. Louis, which is why the state health department is investigating. The state is not saying where the positive case is from, but told us they are testing several people who are around the infected person.
The testing of sick people around a case is not in itself unusual.
Bird flu has the potential of becoming a pandemic.
At the moment, we don't have the evidence that it is of general public concern yet, but I will say that everybody in this field who is following viruses, and scientists and public health officials, are very concerned about this because of these signals that we might be heading that direction with this virus.
Physicians and public health officials are worried the current virus could adapt.
It has been circulating around the globe in several places in the world for about 27 years. And more recently, in just the last year, it has started to change. The virus itself has now been able to infect other animals a little more easily than it had in the prior 25 years.
So what do we need to do?
If you're going to be around sick mammals or sick, birds, don't have any contact with them, or if you're going to have contact with them, make sure you wear gloves and protective equipment, and including eye protection, because there is some evidence that in the humans that have caught this virus, many of them have infection of the eye, which is conjunctivitis.
So now, as with any flu, it is important if you have respiratory symptoms, to distance from others and practice good hygiene to prevent spread of the virus.